Hey there, this is Jenny Chen. I'm the founder of 3D Heals. Welcome to the Lattice podcast, the official podcast for 3D Heals. This is where you will find fun but in-depth conversations with technological game changers, creative minds, entrepreneurs, rule breakers, and more, focusing on how we can use 3D technologies like 3D printing and bioprinting to reinvent healthcare and even life sciences. This podcast will also include AMA or Ask Me Anything sessions, past Instagram live interviews with influencers, and other direct engagements with our tribe. Hey!
Hey Jenny, good morning.
Wow, good afternoon for me.
Yes.
Thanks for joining me. I'm just happy this works, to be honest.
Very quickly, very efficiently. Yeah. Good internet connection so far too.
So a little self-introduction here. I'm Jenny Chen. I'm the founder of 3D Heals. I'm one of the persons behind the 3D Heals Instagram account. The reason why we have this Instagram account, it serves as a point of inspiration and also an alternative, less formal way of connecting with influencers behind their Instagram photos and also organizations. So the guest we have today is William Harley, or Bill, as I love to call you. And you're not only a bioengineering PhD student, almost graduating. Am I not right? Or maybe
more than 1 year to go.
More than 1 year to go.
Yeah.
But you're also the 3D Heals community manager for, I would say, Australia. The only person we have in Australia. But you're located in Melbourne,
I am.
And you've done a fantastic job organizing events, not just for 3D Heals, but also for other bioprinting communities. And very recently, you just organized a very large conference along with the professors, Professor Carmel Gentle, in Melbourne, focusing on bioprinting. So that was an amazing conference, by the way. I learned a lot. But the reason we're here today is to allow our audience to get to know you, and also, your overview of what the ecosystem for healthcare 3D printing and bioprinting is like in Australia. It's relatively opaque to the rest of the world, and we'd like to know more. And of course, we have a conference coming up focusing on Melbourne in a couple of weeks, actually, and that this is a good opportunity to talk about it. But before we go through all that, I do want to know, what is acoustic bioprinting? I think that's a fascinating subject I don't know a whole lot about.
Of course. Yeah, I'll give you a bit of an introduction. But yeah, thanks Jenny for having me on the Instagram live session and, give me more of an opportunity to talk about my research, what my PhD involves. And of course, just a bit of a preview to the 3D Heals Melbourne event that we have scheduled for later in January. So to give a bit of an overview about what my PhD is about and to take back a step about acoustic bioprinting, we know now today that many different fabrication modalities exist for bioprinting, which is, it's progressed a long way in the last few years, with traditional extrusion and inkjet printing dominating, most of the scene in the research and development space. Using acoustics is a really biocompatible way to actually handle and move these cells. And to think about it as a bioprinting process, you can actually use these acoustics or sound in many different ways for bioprinting purposes. But what I look at is more of a bioassembly technique. So what we're actually doing with this acoustics and ultrasonic frequencies is being able to move these cells in a very cell-friendly and biocompatible way within an existing bioprinted construct or within a microfluidic system. So basically, this allows us to fine-tune the positioning in which we want the cells to be placed, and we can also later cure these cells in place to sort of mature this construct to actually grow. But apart, not just my research, but the wider group we have at the Collins Biomicrosystems Laboratory at University of Melbourne, is we all focus on using acoustics in various ways to sort of manipulate and move cells. And whether that be for, arbitrary cell patterning to actually more improved flow cell cytometry, or isolation and these sort of filtration techniques. So it's really quite a widespread technique that we can actually use within this biofabrication field.
So in other words, this is a smart way of moving the cells around without actually harming them.
Exactly, yes, because we know from many printing processes that cells don't like this sheer force. They don't like to be pushed around and moved into the positions they don't want to be. And of course, if you can do this in the most cell-friendly way and provide them, immediate access to nutrients and oxygen to help them grow, it's a far better environment for the cells to mature healthily over a long period of time.
That's fantastic. And I'm assuming that you guys are not the only group in the world who's doing this kind of research.
No.
Any suggestions in which other labs are working on the same subject, and people can also, reach out or read more about?
Of course, yeah. So there's a lot of work being done across the whole world. And one major hotspot I definitely recommend is in Singapore. I know you have 3D Heals has a great connection with Singapore, and the ecosystem there is really booming. They've got lots of great ideas with this, not just the biofabrication side of things, but in 3D printing in healthcare overall. So there's a fantastic group at the Singapore University of Technology and Design that we work with closely with our group that does a lot of acoustics work, and also many groups at Penn State, MIT in the US. There's some in Germany. So it's definitely picking up its pace, and more people are realizing the potential that acoustic forces can have to maybe not directly solely fix this bioprinting problem, but to definitely aid and help in part of the process, in conjunction with other.
Yeah, it's one piece of the puzzle, basically. Now, to maneuver these cells, you need to be able to see it. And now we can kind of jump a little bit ahead to our conference, that we do have somebody from the visualization side, right? Can you use the tools from Upscan for this kind of work?
Yeah, absolutely. I mean, the whole background and idea between Scan's technology is it's a very in situ, in vivo friendly endomicroscopy technology. So, of course, this holds more promise and more practical applications for clinical trials, actually gathering more clinically relevant data. But you can definitely use this in a research and development as well, and the freedom that this technology actually allows us to basically set up and view these different constructs with ease, instead of being locked to a traditional, say, confocal microscopy and other imaging systems.
Very cool. I mean, we will hear a little bit more from them as well directly in a couple of weeks. But let's go back to the Australian ecosystem, the 3D printing ecosystem in Australia. I know you're preparing a blog, which we will publish very shortly. But it's just good to have a conversation about this. Who do you think are the major players in Australia focusing on 3D printing?
Companies, major players.
Companies or government agencies, funding sources, anything incoming in mind?
The major players. Okay, so I'll start with companies. I think, of course, when we're talking about leading on bioprinting and biofabrication work, which is, of course, relevant to my PhD work, you can't look past Inventure Life Science. They're based out of Sydney, and they've been doing fantastic work out of UNSW for the past 5-6 years. They have a leading bioprinting platform here, and recently they've announced more work to be focusing specifically with bioprinting skin, and they're doing a lot of great collaborations with the University of Wollongong and also Fiona Wood from the University of Western Australia, who's a leading burns victim expert as well. In terms of steady manufacturing, Anatomics has been in the 3D printing and healthcare game for a long time, and they're well established. They know what they're doing, and they've released continuous projects and products over the years to help patients. From the metal side, which is an increasing, developing area, particularly here in Australia, we have Aurora Labs based out of Western Australia, and they're really focused on speeding up the process of metal fabrication, not just for healthcare applications, but of course automotive, aerospace, and sort of wide suite. Also in the metal manufacturing, we also have Speed 3D, and basically these two companies are working really well together to improve the speed of metal fabrication and metal 3D printing enormously.
Are they going into the healthcare space?
Yes, yeah, they're doing some healthcare space as well. But we also have Titomics and who else? We have some major players that have really leaned off of funding sources. So I'll move away, and because many of these projects and many of these companies have had a start and have had a great success story, particularly like in venture, from the money that's being put into this system, and from both public and private sectors. But I'll just take a snapshot back to the sort of public money and grant schemes that's being allocated to these sort of projects. And is one program called the BioMedTech Horizons Fund. And this has funded Optiscan before in the past. They've funded Anatomic. They've also funded Inventure Life Science as well. So they're playing a critical role with not just the Victorian government, but also the federal government in Australia to really pump in some serious cash and to help get these these projects and these companies off the ground, particularly. From a research and development space, I think one thing that really Australia has embraced, and we're really, trying to be a sort of a leader in this space, is the collaborative efforts that go on, between these companies, between the institutions, the funding bodies, and of course the regulatory agencies, but also the research as well. And, particularly, PhD students, postdocs, and these sort of labs that are working in various labs throughout the country. I think it's really important that, we have some amazing ideas, but we want to see these ideas actually come to fruition. And of course, you need a company to help guide you through this process. So we're seeing a huge rise in these sort of industry funded and industry collaborative projects in 3D printing and healthcare. Some big players in is RMIT. They do a fantastic job with collaborating with local Melbourne companies, and of course we'll get to a little bit more of that later and for our events in the future. But the key thing I see with this 3D printing merging completely with healthcare system and having a more direct line to clinicians and physicians that will actually ones that will be delivering these, these applications to patients and see the hands. So the way that Australia has sort of adopted this is that we really are taking after the golden example of Mayo Clinic in the US, where they have in-house engineers and application scientists working right next to, the clinicians and the surgeons, for instance, that want to help deliver this technology. So here in Melbourne, we have a fantastic sort of lab called Biofab 3D, and they do some not just bioprinting work for research, but they also do massive amounts of 3D printing to help with orthopedics and robotics. But the great thing about this is that it's actually focused within St. Vincent's Hospital here in Melbourne. So the idea that you can take a patient's cells within the same building and help research and develop this technology in-house, and then speak to someone down the corridor to help deliver this is a really good example. And I think that's the way that definitely Australia is moving forward in the future. And one example, in addition to Melbourne, also at the Metro North Hospital in Brisbane in Queensland. And they work with a fantastic group of Mia Woodruff. It's Queensland University of Technology. And again, they're adopting a very similar model to the Biofab 3D down here, is that, the idea that you can have these engineers, the scientists, biologists, working with the surgeons and clinicians in the same house is, I think, will prove very useful for productivity and actually getting these products, out to patients at the end of the day.
Yeah, no, this is fascinating to learn about different ecosystem because we also have different healthcare systems. I think in Australia is more of a UK model, right? And then for US is totally a different model. And I think how a 3D printing center can succeed in the hospital also depend on the different healthcare system. There are a couple other names that I just thought about while you were talking. I think one is Epic Lab. Is this also within the hospital, or is this
Yes, no, this is attached to Westmead's Children's Hospital. So yeah, thanks for bringing that up.
Yeah.
Really great
Yeah,
example.
they do fantastic work. Yeah, I've seen some of their works. And what's interesting also, I think some of the earlier 3D printing company I came in contact with actually were from Australia. And one company obviously is Anatomics RX, which was founded by a neurosurgeon. And the other actually clinician-funded company is actually called Oventus, which is a sleep apnea device that's personalized, apparently.
Yep.
I think both of them were funded by the same government agency, Cicero, which is another very important entity as well. So I think Australia has definitely invested a lot over the past 5 to 6 years in this space.
Yeah, I think we're seeing, the fruit, that we're seeing sort of the outcomes of this coming to now over this investment. Yeah, exactly. Over the past 5, 6, even longer years. Definitely not just, within Victorian government, but yeah, the wider federal government as well.
Yeah, no, I very much look forward to the guide that you're going to write for us and publishing it so everybody can see. But let's go just talk a little bit about the event in 3 weeks?
Yes, 3 weeks,
Yeah.
January, and it will start at 10 a.m. here in Melbourne at Eastern Daylight Time. And what time will it be in San Francisco, Jenny?
I think it's like around 3 p.m. or something like that, Pacific time. We will publish on the website and everything. We already have a lot of people registering, and we have limited spots, so anyone who's listening should register right away. So tell me a little bit about why, because I handed to you and you picked who is going to speak. Why don't you tell us what's the thought behind picking these speakers?
Of course, I think, like you mentioned before, I've sort of helped out with a bioprinting specific event a couple of months ago last year. I think for me to bring 3D Heals back to Melbourne, because of course we've had a 3D Heals event here in Melbourne before, is to keep it a very general 3D medical technology theme, is to sort of encompass, not just 3D printing in healthcare here in Melbourne, but also some 3D digital design, some modeling, of course, incorporating AI and machine learning into these processes will play a huge part. To sort of give a snapshot as to who's presenting, I've asked Mark Rowe, the managing director of FuseTech, to present as part of our event. They do some very interesting anatomical models for actual surgeons with real pathologies as well. So they really focus on doing high resolution models for these surgeons to actually practice on before they go into the operating theatre, which is fantastic. So I look forward for you guys to actually see some of these real pathologies working in real time with these devices from the presentation. Of course, it's really important for me to include the University of Melbourne, my department within the biomedical engineering department here, and of course, Professor Peter Lee from my department. He's also the director of the Centre for Medical Implant Technologies, which is an initiative by the Australian Research Council, or known as ARC. And this centre and the broader ARC centres really sort of bring together more researchers and industry to sort of tackle this problem head on. And with this centre, with the medical implant technologies, they're aiming to use a wide sweep, of all this 3D modeling, digital design, which is Peter Lee's background, and combine it with, the fabrication equipment that exists within, the CSIRO and other labs to actually facilitate this. We also have Associate Professor Kate Fox, and she's also done a fantastic blog for us for 3D Heals with her 3D printing for diamond work. And, you know, that's very eye-catchy to be 3D printing diamonds that are really
By the
catchy.
way, did you know Kate was a patent attorney before
Yes.
she turned scientist? That's a crazy news for me.
Yeah.
I guess not so crazy looking back. She just loves technology more than law at the end.
It's definitely an interesting transition. You wouldn't hear about many patent attorneys making that switch over. But I think, you know, that lends to her very well. She has that massive understanding and she knows what actually needs to be done and to actually get these products to market as well.
Yeah.
But yes, with some awesome 3D printing diamond work. We mentioned Optiscan, who will also be giving, you know, a nice presentation, a nice overview for us about their endomicroscopy technologies and how this can be used in different applications. And we also have a feature from Monash University, fairly new. He's joined to the School of Engineering. His name is Dr. Yunlong Tang, and he was previously held positions at McGill University in Canada and also in Singapore as well. So, yeah, great track record with using 3D modeling and digital design to actually improve implants and the design process. And he'll give us a great talk about how he's using artificial intelligence with this now.
That's awesome. We actually, I'm actually in the process of planning artificial intelligence, more dedicated track as well, a little bit later this year. This is a fantastic panel. Thank you so much for putting together.
It's my pleasure.
Okay, well, we have some comments and some questions here. Let me just take a look. Well, some of these questions can be very specific. One of the questions here is, can 3D printing be used for development of a below-the-knee prosthetics? And if yes, what kind of material will be suitable and what is the durability? I'm not really sure this is within either of our expertise, but Bill, do you want to give it a shot?
I mean, below prosthesis,
Yeah.
you know, sort of help. You can have, you know, many different types to help with their outer body and actually stability of the leg. But more prosthesis, you can use they can use a wide range of materials from some different biocompatible plastics. You know, they can use even metal implants to help. It really depends, I guess, on what's actually happened to the injury and the severity of the injury with this one. I think, yeah.
Yeah, no, I think you're right. I mean, it really depends on specifically what kind of lower extremity prosthetics we're talking about here. Is either less invasive to more invasive and customized. We're actually going to have a couple of experts a little bit later this year that we can have Instagram live with, and maybe they can answer this question to much more satisfaction.
But thank you.
Yeah. Let me see anything else. Okay, here Danny has a question. What would you say it would be needed in order to work in a place like where you work? I think that's meant for you, Bill. Like, you're in University of Melbourne, right?
Correct. Yeah. As in to do PhD research?
Yeah, PhD. I think that's what he meant.
Okay, right. Well, you have to waste a lot of your life, I think.
I wouldn't call that.
No, it's a long haul. Of course, I think anyone who's willing to do a PhD, as long as you have the passion and motivation to do it, and of course you're interested in do some research, you know, before you apply to do a PhD, you know, most places will be happy to take you on. And, you know, depending if, you know, what field you're working in. And like I mentioned before, you know, there's maybe some more specific requirements to do some industry funded PhDs. But overall, I think if you can have, within Australia, we have sort of a similar model to the UK and Canada, where is if you can do some honours research, which is basically 1 year of research after you do your undergraduate degree, you can begin to start a PhD. But for international people coming into Australia, most of the time the prerequisite is masters, which usually involves a large chunk of that being in research as well. It's that field.
Yeah. It sounds like you have to build up some kind of background, at least to show people of your ability to complete a PhD. Like anything else, I think science, you know, going back to why Kate transitioned into, you know, law to science, I think science is a lot more satisfactory than law, personally, in my opinion. But science is a lot more challenging to do than the regular pushing paperwork, you know, as a lawyer does. It involves a lot of creativity. It also involves a lot of focus, because there are a lot of times you will fail, and you have to climb back up and then believe what you're going to do eventually is going to be successful. You have to have that passion and tenacity. Anything to add to that, Bill?
I think, like you said before, I think 99 times out of 100, everything you do experimentally fails until you push through, until you get the one right. And it makes you, it reinvigorates why you do the research and why you like science so much when you actually see some of these results come to life. And yeah, it really helps drive the motivation.
Yeah, I mean, like even for COVID this year, right? The years of research on mRNA as a vaccine finally paid off, but who knew it was going to be the year 2020? No idea.
Really, that's fantastic to see. Nanotech coming to the day, and particularly with the mRNA vaccines. It's really good.
Yeah. Well, thank you so much, Bill, for joining us today. I hope this was fun for you. I'm looking forward to our Melbourne event. I want to make a surprise announcement that we're going to have a new tool for people to mingle. We'll test it out soon. It's called Topia, and this is where people can say hi to each other in small groups rather than, make announcements to like all 100 attendees on Zoom. So I'm hoping to use it for both our upcoming events, both of our events this month. So
we can try.
Yeah, I think it's gonna work. People liked it when I hosted the New Year's Eve party.
Good. Good test site. Thanks a lot, Jenny. Really appreciate it.
Good catching up, and I'll see you next time.
Absolutely. See you guys. Thank you.
Bye-bye.
Bye.
That's it for this episode. Be sure to follow us on Facebook, Twitter, and Instagram at 3D Heals, and check out the links in the show notes. See you next time.